All right, time now is 9:16. We are looking at this week's health headlines, including how the phrase, "you are what you eat," might not be true. What matters more than what you eat?
Joining us now is professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Streicher. Good morning. Thanks for being with us.
Good morning.
All right, so let's start with the benefits of taking hormone therapy if you have early menopause.
Yeah, we know that right now there are 6 million Americans who are living with Alzheimer's, and most of them are women. The brain is loaded with estrogen receptors, and it's been well established that when a woman goes through menopause, if she takes hormone therapy, it's going to help with that cognitive function. But the real question is it going to prevent Alzheimer's down the road? And the jury has been out on that for a long time. So a new study was really interesting. They took a few hundred women that did not have Alzheimer's who were in menopause. They were all on hormone therapy, and they looked specifically at the amount of amyloid and tau that was being deposited in the brain. Those are the two markers for Alzheimer's. And what they found is that the women who were taking hormone therapy that started it early, within 5 years of the menopause transition, they had almost no tau, no amyloid, which means the likelihood of them developing Alzheimer's down the road is very small. The women who started their hormone therapy later, like 5 to 10 years after, they'd already had a lot of it deposited. So what that tells you is if in fact hormone therapy is going to prevent Alzheimer's, and it looks like it will, you need to start it early. And this is particularly true of women that go through an early menopause, 40, 45. Hormone therapy should be started early and continued.
Are there other worries about hormone therapy, though?
There really are not. And actually,
there used to be, right?
There used to be, and that was based on an older study that was looking at women who started their hormone therapy later, and they were using different hormone therapy that we use now. And what we know is that hormone therapy, if you start it early, estrogen alone decreases breast cancer by 18% in women in that 50 to 60-year-old age group. And there's so many misconceptions out there, and the reality is that the overwhelming majority of women not only should take hormone therapy and they will benefit from it, not just in terms of symptoms, but in terms of length of life, and now maybe Alzheimer's as well.
Okay.
Okay, next up here, you can now get your sexually transmitted infection results instantly.
Practically instantly, 30 minutes, it's almost instantly. When we look at STIs in this country, I mean, first of all, it's kind of scary, but true. The CDC just reported that over the last 6 years, they have gone up by 30%. And a big reason for this is people are not going to the doctor anymore. This started with COVID and has continued, and with virtual medicine, and you cannot get STI testing on Zoom. You just can't. And so people are not getting tested. But then when they do get tested, the traditional methods mean that when you get your test, you might not get your results for 5, 6, 7 days. So the CDC has just cleared a new test, way to test STIs, PCR, like we're seeing a lot of new testing going on. And what this means is that for chlamydia, trichomonas, and gonorrhea, within 30 minutes of going to your healthcare professional's office and getting tested, you're going to get a result. So what that means is you're going to walk out the door not only with knowing your result and some information about it, but with your prescription. And then the downstream results of this is that you're less likely to give other people that infection, and you're not going to get the complications like, long-term pelvic inflammatory disease and fertility. So yes, people have to use protection. They have to actually go someplace to get this test, but at least they'll get the results quicker, so one less barrier.
All right, and a new study about meal size and the number of meals.
Yeah, I mean, are you tired of me coming in every couple of weeks and talking about all these different diets, and you should do this and you should do that, and then it's intermittent fasting and it's this and it's that. When you look at all these different diets that are out there, there's 3 variables that are always being looked at. One is what you eat. The second is how much you eat, and the third is when you eat. And intermittent fasting, of course, has gotten to be very popular because it's not just when you eat, it's when you don't eat. And the idea that this is going to reset your metabolism. But it's not clear which of those parameters is really the most important. So this was a very good study that was done, 500 adults over 6 years, and they tracked all that, the what they ate, the when they ate it, and what they were eating. And what they found, it was very, very clear at the end of 6 years that the variable that made the most difference, it's how much you eat. They looked at small
That's
meals.
shocking information.
Shocking.
But how much you eat? Well,
but the point is the timing didn't matter. Intermittent fasting is so, so trendy right now.
Yeah.
And it's the idea that if you eat small meals, and they're looking at 500 calories or less as being a small meal, the more small meals that were eaten over the 6-year period of time, the more weight someone lost. So it's this idea of, no, the fasting is helpful in that you end up eating less. But this it really comes down to the size of the meal. Americans
smaller
eat
portions.
It's portion control. People eat too much, so
Yeah.
get a smaller plate. We know that works. Eat more slowly, and don't automatically go for seconds. I mean, it's pretty simple, but it's not so simple. I wish it was that simple.
Yeah.
But at least this is information that is helpful in terms of knowing what really is important.
All right, well, you can check out Dr. Stryker on social media. Thanks again for being here.
Thank you.
Hey, send a message to Pat